Welcome to my presentation on Eyelid Rebellion. I am Abraham Sir, a fellowship-trained glaucoma specialist practicing in San Luis Obispo, California. The purpose of this presentation is to provide awareness of a not-so-uncommon complication of glaucoma treatment. This nice lady used multiple glaucoma eye drops for years without issue. Then all of a sudden, her eyelids turned red, thickened, scaled, and began to itch and burn. This is allergic contact dermatitis, a type 4 hypersensitivity reaction. A small molecule in the drop called a hapten binds to skin proteins and forms a complete antigen. Langerhans cells present it to naive CD4 positive T cells, which then proliferate into memory T cells. On re-exposure, memory T cells release cytokines, which recruit macrophages and cause the inflammation, redness, scaling, itching, and oozing. The same mechanism underlies nickel allergy, poison ivy dermatitis, and the tuberculin skin test. Why is the presentation often delayed for years? This can result from a cumulative hapten exposure over time, an increased dose or relative increase in absorption of the hapten, a break in the skin barrier such as trauma or surgery, or cross-reactivity with a new or similar molecule. All classes of eye drop medications used to treat glaucoma can lead to an allergic contact dermatitis, with a beta blocker like timolol as the most common. A close second and third are alpha-2 agonists like brimonidine and carbonic anhydrase inhibitors like dorzolamide. Other ingredients, such as the preservative benzalkonium chloride, is also thought to be a causative agent. Management of allergic contact dermatitis focuses on identifying and removing the trigger while providing symptomatic relief. Most cases resolve fully within 2 to 4 weeks after discontinuing the offending agent. Specific to glaucoma medications, if someone is on multiple kinds of eye drops, it is hard to know if one or some or all of the medications is or are causing the problem. Strategies include discontinuing the eye drop most common to causing the problem or stopping all of them at once. Once all the symptoms are gone, introducing one medication at a time can help isolate the offending agent. There could easily be a relapse, but it is important to know which specific medication is causing the allergy. A discussion of alternative treatments for glaucoma is usually necessary. Treatment can also consist of starting mild topical steroids or steroid-sparing medication. Oral steroid medication and antihistamine medication can also be used. Non-medication options include cool compresses and skin lubricants without dyes or perfumes. Additional testing may be required, which include patch testing by dermatologists or allergists. This presentation shows you a classic example of allergic contact dermatitis, and it does not look good. Keep in mind, this type of allergic reaction occurs at a low prevalence among patients with glaucoma. I don't think patients should be afraid to use eye drops to treat their glaucoma because of fear of this condition. As you can see, the skin returned to normal within a few weeks after simply stopping the medication. The eyelid skin can rebel to eye drop medication in a small percentage of patients. Fortunately, the condition completely resolves with conservative treatment. If you have experienced this or know someone who has and are curious about options, your best source of advice is by consulting a medical doctor trained in the specialty of ophthalmology who further completed a fellowship in glaucoma. The AmericanGlaucomaSociety.net website has a Find a Doctor function. Thank you for watching. Like, subscribe, and share your experiences.